Good evening, everyone, and welcome to the Bahamas Tonight, the National Report. I'm Kishla Adderley. Thanks so much for joining us. The health minister is dispelling rumors about a scarlet fever outbreak in Grand Bahama. It all stems from rumors which have been circulating on social media since this weekend. Well, today, our Jiminy DeSwain spoke with the health minister about the true state of affairs there.
Scarlet fever, a disease that affects children, raised alarms in the second city after reports surfaced on social media that a possible outbreak was taking place this past weekend. This after allegations rose that employees of the Grand Bahama shipyard were quarantined at the Rand Memorial Hospital. Health Minister Dr. The Honorable Dwayne Sands set the record straight with regard to those reports during an interview on Monday with ZNS News.
I read and saw a number of so-called reports on social media alleging that there were 30 persons quarantined and that they had scarlet fever. The substance and spirit of all of those reports were inaccurate. First of all, there were several, less than 5 persons with influenza at the Grand Bahama shipyard, and a single person with scarlet fever who was admitted to the Rand Memorial Hospital, treated with antibiotics because scarlet fever is very, very treatable, and discharged.
The minister notes that while scarlet fever is contagious, it can be easily managed with proper medications.
Truth of the matter is, scarlet fever is hardly ever seen now, and when it is seen in children and is easily treated. Scarlet fever would have the same symptoms as the flu, but it is a complication of a strep infection of the throat. And the reason why it's called scarlet fever is you have a fever and then you have a scarlet rash. Like I said, in the era of antibiotics, that particular infection is very easily treated.
The health minister says he does not know the reason behind the rumors being sparked, but suggests false information can have widespread implications for the country.
Interestingly, people spread a rumor about a disease which tends to affect children, not adults, and which is very easily treatable. So, perhaps the person that wrote it or the persons that wrote it thought that scarlet fever was such a horrible illness that somehow people would be petrified to know that there was, quote-unquote, an outbreak of scarlet fever, which there wasn't.
With this being the peak of the flu season, the health minister is advising all persons to obtain their flu shot. Jiminy DeSwain, ZNS Network News.